All right, so we're gonna go over a few tips on the gait belt, how to put a gait belt on, how to use it, and then a couple exceptions that will make your life a little bit easier. So first of all, on the gait belt you have teeth side and then a smooth side. You're gonna bring the gait belt around the teeth side closest to the patient, and then you're gonna bring the other end through the strap on the teeth side. Bring it around, typically like mid-waist or true waistline. Cinch it up and then bring it around through the other end. All right, so when you're using a gait belt, we're gonna put your hand on the back of the gait belt and have the patient stand up. The idea is that you can keep a hand on the back of the gait belt so that you're close to the patient in case they need you. And then you're just gonna stay close and walk. I'm gonna go over a few additional tips that might help you when using a gait belt. So if you're working in the ICU with any of our post-op heart patients, we like to put the heart pillow on the patient in between their chest and the gait belt. So we're gonna bring the heart pillow in, and then you're gonna bring the gait belt up a little bit higher. If you turn the heart pillow sideways like this, the gait belt will stay a little bit easier. So again, through the teeth, cinch it down. So this just kind of protects their incision a little bit. It also makes it so the chest tubes don't wiggle around as much, making it a little more comfortable for your patient to walk. So then it would be the same thing from there if you're walking them. One other tip with gait belt, if you have a patient who's had a lung procedure like a VATS or thoracotomy, or if you have anyone with abdominal surgery, a blanket makes a good brace. So for the lung procedures, what we typically do is put it over the site of the chest tube, whether it's right under the arm or a little bit in the back, and bring the gait belt around and secure just as you normally would. And then for abdominal surgeries, if you put the blanket in the front and bring the gait belt around, it makes a nice brace if they're gonna cough, sneeze, or anything while you're moving, but also just gives them a little bit more comfort while they're moving.